Hi everyone, my name is Cassie and I am a counselor at Quest Counseling. The purpose of this presentation today is to provide education to women of childbearing years on the effects of alcohol and marijuana on their health and that of the developing fetus. So today I'm going to talk to you a little bit about legalization of marijuana, and some of the main points I'm going to talk about are legal does not mean safe, use responsibly, potential consequences with substance use, and protective capacity for a child. All right, let's get started. So legal does not mean safe. Because of their accessibility and availability, our legal drugs are used far more than our illegal ones. According to recent surveys, alcohol use is used by 52% of Americans, tobacco is used by 27% of Americans, and marijuana is used by 8% of Americans. Legalization of marijuana has triggered disturbing changes in the attitudes and actions of young people. In Colorado, there has been an increase in high school drug violations of 71% since legalization, and school suspensions for drugs have increased 45%. All right, next bullet, use responsibly. So marijuana has been used for years to treat nausea, and there are even FDA-approved THC-based drugs for this purpose. Thus, it's not surprising that pregnant women are using marijuana to control the nausea that often accompanies pregnancy, such as morning sickness. There has been shown to be no amount of marijuana that is safe to use during pregnancy, even to treat nausea. If you are thinking of using marijuana to help with morning sickness, please talk to your provider about other treatments that may be less harmful to yourself and the baby. While this may seem logical to treat nausea of pregnancy with marijuana, women who do this could be putting their child at risk for neurodevelopmental problems and other problems. The FDA does not regulate marijuana. Consequently, marijuana may include contaminants such as pesticides and fungus. However, most states with legal marijuana, such as Nevada, have implemented regulations about pesticide use. The FDA recommends that pregnant and/or breastfeeding women talk to a healthcare provider about potential adverse health effects of marijuana use. All right, bullet point 3, potential consequences with substance use. I did some digging into this and called some of our local agencies to gather more information. I called St. Mary's Labor and Delivery Wing and talked to them a little bit about what might happen if a potential patient comes in to deliver and they are showing signs and symptoms of THC or substance use, and kind of what that means and how they go about dealing with that. So the nurses informed me that they use a care form and ask a bunch of questions, and part of that is screenings for substance use within the last 2 years and prenatally. They inform me that most patients will admit if they are using, and this information goes into their chart, and then a hospital social worker is then informed, and their case will be looked into. Patients who have admitted or are showing signs of substance use are informed that a drug screening will be undertaken, and they are actually allowed to refuse the drug screening, but are informed that the baby will be tested and they cannot refuse this test on the baby once the baby's born for any sort of substance use. The social worker at the hospital will then inform and educate patients on the risks associated with substance use, and inform them that just because specific ones are legal does not mean it's safe for themselves or the baby. Next, I called Child Protective Services and kind of asked them a little bit about what happens once the hospital social worker informs CPS about the patient's substance use and or the baby being positive for a substance such as THC. So they let me know that within 24 hours, a social worker from Child Protective Services, or CPS, is informed and will come out to talk to the patient, ask them a little bit about when they were using, how much they were using, why they were using, how much, how often. Did their OB know? What is their current plan and plan moving forward with using or not using? They'll educate them on the using during pregnancy, or sorry, breastfeeding and some of the repercussions of substance use while breastfeeding. And they will also probably give them referrals or references on, such as like a treatment center, or references on educating themselves as being a first-time parent and substance use. And then they will basically determine if a case will be opened or not. If you use marijuana during pregnancy, your baby may have problems after birth. The baby may be more likely than other babies to spend time in the neonatal intensive care unit, also known as the NICU. The NICU is a nursery in a hospital where sick newborns get care, even for substance use. So exposure to marijuana during pregnancy may cause some problems for the baby after birth, such as withdrawal symptoms like tremors or shaking, long periods of crying, problems with sleeping, and maybe when they get a little bit older, problems with their behavior, memory, learning, problem solving, depression, and even paying attention. I also wanted to touch a little bit on breastfeeding with substances, or specifically marijuana. So the main proactive component of marijuana is THC. THC is excreted into breast milk in small quantities. The duration of detection of THC in milk can range from 6 days to greater than 6 weeks in various studies. Hence why we, as clinicians and social workers and hopefully nurses, will educate patients on the risks of substance use and THC while breastfeeding for the baby. All right, let's sum it up. The last bullet point is protective capacity for a child. And what this means is I basically wanted to touch on how treatment facilities and clinicians and what they are bound by to report to social services. So some of the questions that a clinician might ask if a mother is telling them that they use substances such as THC might be, you know, where's the child when you're using? Where do you store or keep the substance? Is it out of reach of the child or children? How much are you using? How often are you using? Are you driving with the child or children after you have used? Have you ever blacked out or been incapacitated while using? Also, are you using with your child? So some parents may be using themselves and then decide to use whatever substance that is, for this instance, marijuana, with their child and provide that for them to use together. So those are some of the questions that we as clinicians might ask to better understand the substance use and potential risks for abuse or neglect of that patient. I do want to make a main point that we as clinicians cannot report to CPS if a client is using substances prenatally. All right, I hope this was some good information for you guys and gave you a better understanding of legalization of marijuana and some of the potential consequences and adverse effects on the baby and the parent. All right, thank you.